Hey folks, this is Doc Rich Bevan-Thomas at Prostate Cancer Live, talking about another interesting presentation, and this one was presented at the 2015 Genitourinary Cancer Symposium in Orlando. So what is the topic of this presentation? It was very fascinating. Early evidence of increase in higher risk prostate cancers from 2011 to 2013. So this is one of the things that I, as well as some of my partners, have seen more recently, is that we are actually starting to see more patients actually come in with higher PSAs than we did certainly in the 2000s and the 2003 to 2010, give or take. So here's how they designed this study. So they actually retrospectively looked at over 87,000 men in a particular database. The database they used was the National Oncology Data Alliance. And the reason why they used this is it was a very robust database from 2005 to 2013. So what does this mean? Well, so when I originally I heard of this actually being presented and this was written about, I thought, wow, we're starting to see higher grade prostate cancers, i.e. Gleason 8, 9s, or 10s. We are seeing some of that, but this particular paper actually looked at the definition, and the definition here is a PSA of greater than 10. And so what we saw in 2005, and we've discussed this on numerous different occasions, is the importance of screening for prostate cancer. As that PSA increases, there is a higher chance. Number one is that patient, if they do have prostate cancer, that prostate cancer is more, they have increased amount and volume of a cancer, but there's always a higher risk that the cancer gets outside of the prostate, gets the lymph nodes, and of course becomes metastatic, which is outside into the bones. So with that in mind, what we're seeing, and this is just only a period from 2011 to 2013, is that the proportion of men diagnosed with intermediate or high-risk prostate cancer only from PSA alone. So now we're seeing more people, more men who are being diagnosed with prostate cancer with a PSA above 10. So why is that important? One would say, okay, well, so we're finding them just a little bit later. It's important in this particular thing. And again, they hypothesize this, but I think that there's it's 1 + 1 does equal 2 in this particular thing. They predict that because we are not seeing men in that range where that PSA is below 10, which we were seeing ever since the advent of the PSA in the late 1980s, really it started in the 1990s more than anything else. But that being said, when we started seeing and started testing for the PSAs, we were finding men really with that PSA between 4 and 10 and subsequently between 2.5 and 10. And so those were actually in the lower risk or lower intermediate risk, really lower risk categories. You get in the intermediate risk category when that PSA gets above 10. So there is a 3% increase per year. So from 2011 to 2013, increased risk, 3% per year of patients with a PSA above 10. Again, what does that tell us? It tells us that at least 1,400 additional men may die of prostate cancer each year. So there is a correlation between when we find those men with prostate cancer. If that PSA is above 10, there is a higher mortality, i.e. death rate from those patients. Okay, this gets a little concerning because with all of the debate about when and if we actually check PSAs on patients, if we are finding men in the later stages of prostate cancer or the more advanced where that PSA is up to, we are now going to increase the number of men that either have or will develop prostate cancer that will become metastatic and subsequently cause that man's ultimate demise. It is particularly important for us to stay vigilant and ensure that men continue to be tested for this. Again, in this particular presentation, they say, look, you still got to talk to your doctor about this. I agree with that. Whether you're at high risk, if you have a significant family history, it is, however, important that you get tested. The takeaway from this presentation is get tested and know your PSA. It is important that you know what that PSA is and your risk of potentially having a focus of cancer, because the lower the PSA is when we diagnose a man with prostate cancer, the better his prognosis and the better chance we can cure these men. So if you're a man and you don't know your PSA, depending on your age, but I would say over the age of 40, certainly with a family history of prostate cancer, I would make sure that you know your PSA. If you are in church or if you just have buddies around that don't know what their PSA is, and they're in that same age group. Make sure that you spread the word. You could save someone's life. I tell this to my patients all the time, and I can tell you, you can all make a difference. This is Doc Rich Bevan-Thomas from Prostate Cancer Live, signing out.
On this field, a single decision can change a game. For a man with prostate cancer, a single decision can change his entire life. While I chose surgery, a less aggressive approach called active surveillance might be the best choice for you. Ask your doctor about a genomic test that may help you make the right decision. Learn more at yourprostateyourdecision.com.